drugs works on the dopaminergic system. And most drugs work in the same thing, in the same area, and it works repeatedly on that system until the receptors are burned out. So I want to play you guys an actual clip from Oxford University. So it is quite a, can I screen share, please? It's quite an interesting one. Hi, Gareth. Okay, if you guys can just get me to screen share. Hi, Cheryl. Can I screen share? Thanks. So I want to start out with showing to you how it works. Now, the big thing about this screenshot is it talks about opioids, but opioids is not the only thing that works on this system. So put your drug in there. Don't think, I'm using alcohol, it's not in there. Put your drug in here so that we can have a look.
This is Susan. Susan loves to bike. While out for a ride, she falls and breaks her arm. Special cells called neurons send a signal through the spinal cord to the brain, which interprets the signal as pain. Susan understands the pain means she needs to go to the hospital, and her body is equipped for survival, helping her not to panic so she can seek help. Many of her neurons are covered in proteins called opioid receptors. These receptors act like a brake to slow down the neuron's ability to send pain signals. When injured, her body releases natural painkillers called endorphins. Like a key in a lock, endorphins activate opioid receptors, slowing down the pain signal and preventing a panic. Susan gets treated for the broken bone, but 3 months later, her arm still hurts. And now that pain is making her feel depressed and anxious. So her doctor prescribes an opioid painkiller. There are many different opioids, but they all share a chemical similarity to our own endorphins. This allows them to bind to the same opioid receptors and stop pain signals. But that's not all they do. Deep inside Susan's brain is a region called the ventral tegmental area, or VTA for short. The VTA is full of neurons that produce a chemical called dopamine. When something good happens, dopamine is released, giving Susan a feeling of pleasure. This helps teach her brain to keep seeking out good things. To keep dopamine neurons in check, inhibitory neurons keep the brakes on until something good comes along. Just like the pain neuron, these neurons are covered in opioid receptors. When Susan takes the painkiller prescribed by her doctor, the opioid receptors turn off the inhibitory neurons and release the brake on the dopamine neurons. The rush of dopamine temporarily eliminates Susan's depression and anxiety, and she feels relief, calmness, and even euphoria. As Susan continues to take the painkillers, her brain responds by trying to regain its balance. Her inhibitory neurons work extra hard, even when the opioid receptors are activated, and it becomes harder and harder for her dopamine neurons to release dopamine. Susan finds that she needs to increase her dose of painkillers in order to feel comfortable. This is called tolerance. Eventually, Susan's pills run out. Inhibitory neurons that had been working overtime are let loose, clamping down on those dopamine neurons and shutting them off almost completely. Now, not only is Susan in pain, but the depression and anxiety come back. On top of that, Susan feels ravaged by an inescapable physical sickness far worse than any flu. Susan's body is going through withdrawal. Most people who take opioids for a long time tend to experience some withdrawal, but they can still stop taking the pills and return to normal. But for people like Susan, it's not so easy. Her genetics and the environment she grew up in put her at a higher risk for addiction. Her withdrawal symptoms aren't just unpleasant, they're unbearable. Susan thinks the only way to feel normal is to find more opioids. And this is how the cycle of opioid addiction emerges, driven by a brain trying to regain its balance. But there is hope for Susan. Though the road to recovery can be challenging and there may be setbacks, treatment can retrain Susan's brain. With the help of medication, and therapy, Susan finds pleasure in her life once again.
The big thing is that it may look like it's only opiates that works this way, but everything works this way, including cannabis, pornography. All is into the dopaminergic receptors. And if you use too much and you get too much, they are starting to block and they slow down. And nothing you do will ever give you that first rush again. And people talk about that. But we always think there's one drug that's better than the others. I'm wondering if you guys know what is the worst drug of all drugs. If we look at bad drugs or good drugs, we look at morbidity and mortality. So how many people die from the drug and how many people has a negative influence on their lives according to the drugs. And everybody always says, yeah, heroin. No, guys, it's alcohol. Heroin is second, and then it's tobacco, and then it goes on. And dagga is quite high up on this list because the morbidity it can cause is quite high. It doesn't cause a lot of people to die, but it does cause a lot of people to lose their lives. And hear me out, heroin isn't just heroin, that includes painkillers. So painkillers is up there with one of the worst drugs that you can use. So all those codeine you use, etc., it's one of the worst drugs you can use. Do not think that that is a baby drug, because it's not. There is no such thing as a baby drug. So why is dagga so important? I'm going to show you guys another photo. In my spare time, which I don't have, I do something called TMS, transcranial magnetic stimulation. And that is, we're looking at the brains and we do something called a PET scan, which is we're looking at the connections of the brain to other areas. And this is how a normal brain should probably look. There's quite a lot of connections. Each one of these we measure. So we like a roadmap. We measure from the one end to the other end, how many connections is there. Some of the connections is blue because they're dopaminergic, or red and they're quite heavily trafficked. The blue is not dopaminergic, it's because it's used quite often. So it's part of the brain that's very often used. And we put the brains on parcellations. So every little block on this brain is connected to another block on the brain. And that is how our brains work. I want to show you in a PET scan what does dagga look like. Remember, the more active your brain is, the worse it is. The worse it is. So lots of activity causes you that you can't think. You need a little activity so that you can think better. So the top one, this is of a dagga addict that has smoked. They've asked her to stop 12 hours before, and then she smoked. So after 1.5 minutes, you can see there's a little bit of a increased activity, which is what we don't want. After 31 minutes, the activity even worse. And you can clearly see after 43 minutes how bad the activity is. And this, guys, is dagga. This isn't even one of the what you say heavy drugs is. Dagga is about 5th out of all the drugs. So it's alcohol, heroin, tobacco, cocaine, dagga, and then the rest goes. Oh, and benzos is after dagga. But you can see here that increased activity, that's damaging. And if you continue doing that for a long time, that area stops working as normal. So we see that in drug abuse that people are seriously using and damaging their brains. One of you asked me, have I damaged my brain? Yes, you have. Just by using, you have decreased the chance of living to your old age without dementia. Drugs cause dementia. We can't say that you're going to get dementia in 2 years' time. What we can say is if you use DAGA, you have a 30% higher chance of having dementia at the age of 70. So 70 sounds far away, you know, but it's quickly. Tell me, I feel like 19 the other day, and I'm midway to 70. So you do damage your brain. So what is the big damages that all the drugs do? So let's start at heroin. Heroin stops the dopamine, like all of them. It also stops some of your opiate receptors, and it can cause quite a bit of sedation, which then cause brain damage. And it can cause numerous other side effects. So let's talk a bit about alcohol. Alcohol's mortality is quite high, hey? Because every person that drives on the road and have an accident, that's an alcohol mortality. We know it's quite high. We've seen it now with COVID. If we stop alcohol sales, the admissions to ICUs half or even quarter. I just want to close this. So it even quarters the amount of admissions. So most people that die from car accidents is due to alcohol. And it's not you that drink it. It can be anyone on the road that drinks it, walking or driving. What is the reason for tobacco? Tobacco is often lung cancer and COPD, where you can't breathe anymore, where you need oxygen. And you've got a high percentage of it. Oxygen, the COPD with tobacco is about 50%. If you thought that DAGA would skip that, that's nonsense. COPD with DAGA is 30%. So no, it's not as bad as cigarettes, but it's definitely not good. 30% of people that smokes DAGA on a regular basis is going to have COPD. They're going to have to need oxygen to survive. They will have pumps, they'll die early, their lung function goes down. Then you look at, I skipped to DAGA from tobacco, but tobacco is also secondary smoking. So it's people around you that smoke. South Africa has quite strict rules and regulations to try to get that done. That's why we can't smoke in restaurants, etc., or only in smoking areas. Then we can look at crack cocaine. You know, guys know the detail of that. Let's start at the sexual transmitted diseases that you get with that, the risk for sepsis, your brain that goes down, because all of these causes brain damage. There's two of them that do not cause brain damage, and that is mushrooms and LSD. They are the only two that has been proven not to cause brain damage. Every other drug that you can think of that you use, including the DAGA, causes brain damage. And remember, some of them causes more. So I must say alcohol causes the worst. We get a syndrome called Wernicke-Korsakoff, which is the severity of alcohol's brain damage, where people have difficulty walking and they can't remember and they can't make decisions. And I must say, of all the people that comes in with alcohol, we try to turn it around with thiamine. So we give them vitamin. That's the cause of Korsakoff's to people with alcohol, and they have to keep on taking the vitamin for the rest of their lives. But we try and stop it, but we can't always stop it. And every single patient that has come in this last year with alcohol have some brain damage. And yes, sometimes we're lucky enough to turn it around with thiamine, and sometimes we're not. But I have not seen an alcohol patient comes in to changes that we didn't have to treat that for. The big thing with DAGA is DAGA has about 120 cannabinoids. You know, tetra, all of them together. If we look at them, only about 5 of them is problematic. 2 of them can cause depression, 1 causes amotivational, and 2 causes psychosis. So I can smoke DAGA for a very long time and stay healthy. Or I can smoke my first soul and get psychotic. if you looked at DAGA for the long term, the studies that said how safe it is was mainly done in the 70s and 80s. And on average, cannabinoid contained about 120 to 150 cannabinoids. Now, if you smoke azole, they contain 150,000 to 250,000 cannabinoids. That means a cup of coffee won't kill you, but do you guys think 100,000 cups of coffee will kill you, the amount of caffeine? That's the difference of DAGA, what you're getting. Is you're getting this huge amount of cannabinoids. No brain is supposed to work with that. What happens? If you are susceptible to the DAGA, you will get psychotic. I worked in Sterkfontein, and in Sterkfontein, you admit about 20 patients a day. Of that 20 patients, Gareth?
Sorry, am I on here? Hang on.
Okay. I worked in Sterkfontein, and about 20 of the patients, we admitted 20 patients a day, of which between 15 and 18 was due to DAGA. They all had psychosis, and what do you guys think happens with them? They're often there for 3 to 6 months in the wards. The doctors see them once a month, once every 2 weeks. They get high dosages of medication, and then in 6 months, when they're better, they get kicked out without any proper treatment. And that is what happens if you're psychotic. If you're so psychotic that you are dangerous, you get sent to a government hospital because we can't manage you in private. And then you might end up in Sterkfontein for 6 months. I spoke to a lot of psychiatrists. A lot of them said they'll try some of the drugs, especially mushrooms and so on. None of them will try DAGA. Not one psychiatrist I know will try DAGA. We are all scared because we know how much of a disaster it is in people's lives. That if I go psychotic now, I lose everything in my life. And I then end up 6 months in a rehab or in a Sterkfontein or wherever. And a rehab is the better one of the choices because Sterkfontein is pretty bad. And that is what DAGA does to you, is a long-term problem. It's always interesting for me to look at those slides about how much damage it is, because you don't notice the damage immediately. You feel fine. People around you often see it first, but you often only see it in your 40s and 50s. So the people that come to me in their 40s and 50s and had used DAGA when they were young, they're the ones that we have problem with their memory, problem with their thought processes. And we have to try to sort out something which we probably can't fix because they have the brain damage. So is there any questions? Because then I can talk around questions. I have to tell you, there's a few researchers out that said riding horses is more dangerous than using mushrooms, which is probably true. But there's a lot of research that says DAGA is more dangerous than using alcohol. And I don't think so. I think alcohol is the top drug, but there's lots of research that says different. And it's an interesting way of looking at things, that it's not about how you feel now, it's how you feel in future. What's going to happen to your brain in future? I sit with a lot of people at the TMS with those brain things. But I'll tell you a little bit about that just because I'm interested. And it's my current hobby that I do when I have spare time, which I don't have. That these maps is like a map of Joburg, where people drive from Sandton to Melville, and people drive from Hillbrow to Melville, and they drive from Melville to Krugersdorp. So this is the map like that. And the traffic, in order to think the quickest, or to drive the quickest from Sandton to Krugersdorp, there should be no traffic there. So you want a quiet brain to do that driving. Dagga makes that brain unquiet, makes that brain full of traffic. And that's the big problem. You can still reach from Sandton to Krugersdorp, you'll still get there. It's going to take you a lot longer. And that we call processing speed. And that we almost always pick up as a problem. If Danny do those tests, processing speed is almost always there. And it's because there's too much traffic in your brain. So yeah, this is like showing the extra traffic that's not there. And it's showing that at this stage, this lady is 27, her brain doesn't show any damage yet. But I'm telling you, an older patient does. And you have a bigger chance of dementia. And it's interesting, I've got a bigger chance of dementia because I've got epilepsy. If I don't drink my medication, I can guarantee you by the age of 55, I'll have dementia. So I take my medication every single day because I don't want to be at 55 and have dementia. And that's the thing that some of the medication do. The medication often protects your brain. So there's some medication that's specifically for protection, and they are like the Inner or Brintellix or Lamictal or Seroquel. So often we put people on the same medication, but it's because those medication is the only ones that has proven to stop the dementia from when you get older, to help with the traffic when you get older. Because that's it, you know, we need to start protecting your brain so that it can keep working. And at this stage, it's not really working that well, most of you. Most of you have a lot of traffic there. And the more traffic you have, the bigger the problem, long term.
You know, we've got many patients who, when they come in, they don't know they're psychotic. So you and Dr. Buller give them meds, stabilize them, and then we take over to do the rehabilitation. And many, many young people minimize the effects of marijuana. And they often say to us, I think every intake, at least 40%, 60% say, well, I'll stay off the drugs, I'll stay off the alcohol, but weed is my thing. It's either my culture, it is either my cozy blanket, it's something that my family use, it's decriminalized. And we really struggle because they didn't know that their psychosis was triggered by the marijuana. It might very well have unleashed their bipolar and their schizophrenia and all the other mental health conditions, but they don't know that they were sick. So how do we work with them to get them to understand?
This is the most difficult thing of all, because your brain protects you from the knowledge of psychosis. Because if you have to realize exactly how sick you were, your brain cannot manage that. So you do not remember the amount of psychosis, about the amount of illness. Sometimes it helps to get the family to tell you exactly how sick you were, or the staff, but most people don't believe us. They just don't. And it's the biggest problem in psychiatry, is if somebody comes in and they're psychotic and they just don't believe us. I sometimes go back and I read to the patient word for word what they said to me. And then they would go like, yeah, I don't know what I did. I don't know why. And that's the problem, is that, but let's talk a bit more about psychosis. I wanted to the other time and I didn't. Psychosis has 2 or 3 definitions. The one is a problem with salience. Now, salience is how you experience the world around you and what it means to you. So a severe problem with salience will hear an air conditioner and think that it's the ocean, and they'll believe it's the ocean. a little bit of salience problem would hear the aircon and think, does sound like the ocean. And if you not have any problem with salience, you will know it's the aircon. The little bit of salience where you think, it does sound like the ocean, that's enough already to be on the way to psychosis. So that's the one way of looking at psychosis. The other way of psychosis is it's a formal thought disorder. And this is a very difficult one. If I have to explain to you formal thought disorder, I'll do it this way. I'll say, what did I have for breakfast? Well, I had egg and tomato. So if I have psychosis, but I have circumstantial psychosis, I will say, you know what? I got up and showered. I couldn't find a shirt I really liked. And then I had an egg. And you know what? There was also tomato on the plate. And if I have tangential psychosis, I will go, you know what? I got up and I wanted to eat, but then I started working. And you know what? That chair of mine is just not sitting comfortable enough. If I have a loosening of association, I would go, I had eggs. You know, egg yolk is quite a dark yellow. I like dark blue. Blue is very interesting. Or psychosis is where you hear and see things. It is not only when you hear and see things. These other places is also part of psychosis. It is when your brain does not take the straight road from A to B. Now, I have to tell you, it's a very difficult thing to see and to understand. When I started studying psychiatry, it took me 2 years from just sitting there and listening before it clicked into my head what psychosis is. So if it takes somebody that's not psychotic 2 years to understand psychosis fully, to explain it to somebody that's psychotic is almost impossible. It often helps if you trust somebody, if they can tell you what happened. But you also need to realize that if somebody say you're psychotic and they are professional, they probably know what they're talking about. It's a difficult one. You know, it's easy if I say it's just when you hear things or see things. It's not that easy. Psychosis is also not only looked into drug abuse or only into schizophrenia or only into bipolar or only into depression. All of them can give you a psychotic thing. All psychosis, however, need to be treated with an antipsychotic. We've got some nice medications currently. Most of the patients will be a lot less psychotic within 4 days, almost no psychosis within 10 days. And then they sit there and they said, why must I take the medication? And I just go, if you don't, your brain's going to fall back in psychosis. And if your brain falls back in psychosis, you're going to cause more damage. And that's what we're sitting with.
I think, addiction and mental health are the two illnesses that convince you that you're fine and you don't have them.
Yeah.
And, we hear it the most. You were talking about the psychiatrist not touching marijuana. When we get asked, what's the worst drug on the planet? I have 2 answers. I always say to the person, the drug that you are using. And then if you ask my professional opinion, for me, it's marijuana. Because there's so much culture and so much enmeshment and so much passion. And it is the one drug that will literally change your brain as we're watching it. And the person smoking it thinks they're fine. Heroin addicts know they love heroin. They'll tell you, I'll sleep on the streets. I will rob your grandmother. I will steal your shoes. They have no problem. Marijuana addict comes in and he's little Kim. Like that's the paranoia, psychosis that we deal with. We've had more Elon Musks in rehab then Elon Musk has had thoughts of the next project he's working on. And that's the marijuana psychosis.
And queens.
Yeah.
And kings.
Lil Wayne, I think he's the most talked about rapper in rehabs. Are there any more questions? We can't see the Northcliffe population or the farm population, but I'm sure there's more questions or statements you have for Dr. Thea.
Hi, Dr. Thea, it's Clive here.
Hi, Clive.
Dr. Thea, with marijuana, a person can present and arrive here in a cannabinoidal psychosis, okay? First time. And this is what's scary, is if they pick up that marijuana again, does the psychosis get actually longer and worse? And what are the impacts of that?
Every time you're psychotic, your brain gets damaged more and more. And the psychosis depends on how much of the psychotic cannabinoids was in your zol. So it doesn't always get worse, but the brain damage gets worse each and every single time. Normally, because your brain damage are worse, you have a smaller chance of getting back to normal.